Okay, imagine this. You wake up, maybe middle of the night, maybe after a bit of a celebration, and bam, this sudden, just awful, searing
Oh,
pain.
yeah.
Like your big toe or maybe another joint is literally on fire. It's red, it's swollen, throbbing like crazy. Well, that's pretty much what happened to this guy, a 32-year-old night watchman. Had a few drinks after a shift.
Right.
Wakes up, severe pain, inflammation, redness, left big toe. His labs came back, uric acid, 9.5 milli-GDL. And the diagnosis? Well, you probably guessed it, gout.
Classic presentation.
So today, we're really digging into something I find fascinating, how gout, this incredibly painful thing, actually works, like down at the molecular level.
Yeah, the biochemistry is quite something.
We've been looking through some really detailed research, and honestly, I think what we found might change how you think about it. Our mission really is to go beyond just, ouch, my toe hurts.
Right.
We want to dive deep into the surprising biochemical stuff behind it. Like, how can alcohol trigger an attack, biochemically, I mean? And how does medicine target those exact processes?
It's pretty elegant, actually.
Yeah. And the sources we've used, they give a really in-depth look into the body's, complex chemistry.
Definitely.
Okay, so let's unpack this then. What exactly is uric acid? And, how does it even form in our bodies?
Right. So it sounds bad, but uric acid is actually a totally normal part of our body's chemistry. It's the end product when we break down something called purine nucleotides.
Purine nucleotides.
Yeah.
Those are like building blocks for DNA and stuff, right?
Exactly. DNA, RNA. So specific purine bases, think molecules like adenine and guanine. They get broken down, catabolized into hypoxanthine and xanthine.
Okay.
Then this really crucial enzyme, xanthine oxidase, it steps in.
Xanthine oxidase, got it.
And it oxidizes both hypoxanthine and xanthine. And the result of that reaction, uric acid, it's happening all the time.
So it's a natural process.
A natural ongoing process, yeah.
For ages, I just figured gout was all about diet. Steak, red wine, that kind of thing.
That's the common perception, for sure.
But the research you shared, it really threw me a curveball. There's this whole other category of things that can cause gout. Secondary causes, you call them. What are those?
Yeah, that's a really critical point. It makes gout way more complex than just diet. So secondary gout usually comes down to one of two main problems.
Right.
Either your body is making too much uric acid or it's not getting rid of enough.
Ah, okay. Production versus excretion.
Exactly. So on the overproduction side, you can see things like certain blood cancers, like leukemia. Lots of cell turnover means lots of purines breaking down.
Wow, okay. Didn't expect cancer.
Yeah, and chemotherapy too, because it kills cells rapidly,
Yeah.
releasing all those purines. Also, things like psoriasis, significant trauma, even starvation can increase production.
Starvation, how does that work?
Well, during starvation, the body starts breaking down its own tissues, including cells, which releases purines.
Okay, that makes sense. So what about the other side, not getting rid of enough?
Right, decreased excretion.
Yeah.
The most obvious cause here is kidney problems, like renal failure, if the kidneys aren't filtering properly.
The uric acid builds up, even if you're not overproducing it.
Precisely. And certain medications can do it too. Thiazide diuretics are a common one.
Used for blood pressure often, right?
Yeah. And also, interestingly, metabolic states like lactic acidosis or ketoacidosis, they can significantly reduce how well your kidneys excrete uric acid.
So things totally unrelated to diet or kidneys directly can still mess with uric acid levels.
Absolutely. And what's really fascinating, or maybe a bit scary, is that gout can sometimes be like an early warning signal. It might be hinting at something serious like leukemia, as we mentioned, or other underlying issues. It's not always just about that extra serving of shellfish.
That really changes the perspective. Okay, now this next part, especially thinking back to our night watchman, this is where it really clicked for me. The alcohol connection. How exactly on a biochemical level does alcohol trigger a gout attack?
Right, this is a beautiful, intricate cascade. So when you drink alcohol, your liver metabolizes it. First into acetaldehyde, then into acetate.
Okay.
Now that process uses up a really important molecule called NAD plus A. Think of it like a rechargeable battery or a shuttle bus for electrons in your cells.
NAD plus A.
Got it. So alcohol metabolism depletes NAD plus COM, which means you end up with less NAD plus and more of its counterpart, NADH.
Yeah.
The NAD plus NADH ratio decreases.
Okay, less NAD plus A, more NADH. What does that do?
Well, that high NADH level pushes your metabolism towards producing more lactic acid.
Ah, lactic acid, like from intense exercise.
Sort of, yeah. But here it's driven by the alcohol metabolism.
Yeah.
And this lactic acidosis, the buildup of lactic acid, directly reduces how much uric acid your kidneys can excrete.
Wow. So alcohol makes you produce lactic acid, which stops your kidneys from clearing uric acid.
Basically, yes.
Yeah.
More uric acid stays in your blood. But wait, there's another layer.
Oh.
That increased lactate also lowers the body's pH slightly, makes things a bit more acidic. And here's the kicker. Uric acid is much less soluble in acidic conditions at a lower pH.
Less soluble, meaning it falls out of solution.
Exactly. It precipitates out as sharp, needle-like crystals, monosodium urate crystals. And where do they precipitate? Right into your joints.
Ouch. So that's the inflammation and pain, literal crystals stabbing the joint lining.
That's it. Microscopic shards of glass, essentially. That's what causes that intense, acute, gouty attack.
Man, it really makes you think, doesn't it? How many other things we do, like having a drink, are setting off these quiet little biochemical chain reactions inside us?
It's happening all the time. The body's chemistry is incredibly dynamic.
So, okay, an attack hits. Excruciating pain. What's the immediate plan? How do you get relief? And then what about stopping it from happening again? Long-term strategies.
Right. So immediate relief is all about tackling that inflammation. Anti-inflammatory drugs are the key.
Like ibuprofen.
NSAIDs like ibuprofen or naproxen are definitely options, yes. But often, a drug called colchicine is used. It's quite specific for gout flares. Corticosteroids are another alternative, especially if NSAIDs or colchicine aren't suitable.
Colchicine. Okay, so those calm the fire down.
Exactly. They reduce the pain and swelling of the acute attack. But they don't fix the underlying high uric acid level.
Right, so that's where the long-term stuff comes in, like allopurinol, which our night watchman was put on.
Precisely. Allopurinol is for long-term management. It's a really clever drug. Chemically, it looks a lot like hypoxanthine, one of those precursors we mentioned earlier.
The stuff that gets turned into uric acid?
The very same. So allopurinol acts as a competitive inhibitor for that key enzyme, xanthine oxidase.
Ah, it blocks the enzyme.
It does. It essentially gets in the way, preventing xanthine oxidase from converting hypoxanthine and xanthine into uric acid.
So you just make less uric acid.
You make significantly less uric acid.
Yeah.
And the neat thing is, those precursors, hypoxanthine and xanthine, they're much more soluble than uric acid.
Easier for the body to handle and get rid of.
Much easier to excrete. It's actually a classic example of something called suicide inhibition in biochemistry. The drug basically tricks the enzyme into inactivating itself.
Wow. Okay, so that's allopurinol blocking production. Are there other approaches?
There's another class of drugs called uricosuric drugs. Probenecid is a common example.
Uricosuric, meaning it affects urine.
Sort of, yeah. It increases the excretion of uric acid by the kidneys. It works by blocking the reabsorption of uric acid back into the bloodstream from the kidney tubules.
So instead of blocking production, it helps you pee more uric acid out.
Exactly. It helps your body flush it out more effectively.
So, okay, summing that up, we've got drugs that stop uric acid from being made in the first place by blocking that key enzyme.
Allopurinol.
Right. Or we have drugs that help the kidneys get rid of more uric acid.
Like probenecid.
So if allopurinol cuts production and probenecid boosts excretion, do doctors sometimes use both? Or is it usually one or the other based on, like, why the person has high uric acid?
That's a great question. Usually the choice depends on the underlying cause. If testing shows the person is an overproducer of uric acid, allopurinol makes a lot of sense.
Right.
If they're an underexcreter, meaning their kidneys aren't clearing it well enough, then a uricosuric, like probenecid, might be the better first choice.
Okay.
Sometimes, in really tough cases, they might be used together, but usually you start with the one that targets the main problem.
Makes sense. Address the specific imbalance.
Exactly.
Wow. Okay. So we've really gone deep here today. From just, the agony of a gout attack, all the way back to the specific molecules, the purines, the enzymes like xanthine oxidase, and how it all connects.
Yeah, the Purine catabolism pathway.
And seeing how things like alcohol metabolism can throw a wrench in the works.
Through that whole NAD plus NADH and lactate mechanism, yeah.
And then how the treatments, like allopurinol, are designed to very precisely target those specific biochemical steps. It honestly clicked for me how interconnected it all really is.
It really is. And understanding these mechanisms, it's not just about gout, is it? It gives you a much richer appreciation for how your body works on a fundamental level.
Yeah, absolutely.